In a magical place where lives are saved every day, all eyes focus on one prize: top decile performance, AAA.
If we're really serious about taking our performance to that level, if we really want to achieve that vision of national leadership, we have to make a change.
The change is coming. Can you step out onto the court?
How can we ever achieve top decile patient satisfaction, top decile quality scores, if our employees do not love coming to work every day?
The change is already here. Celebrating August 28th, 29th, and 30th.
Live the values.
Ask your supervisor to register you for the People Excellence Celebration. Don't wait. The countdown has already begun.
Don't you get the sense that something's a little bit different?
More than 700 area physicians have joined what is called Triad Healthcare Network. We will explain how that may be the future of healthcare. There's a new attendance policy heading your way. Details on that and more in this month's Code View. There's a chance you haven't heard of Triad Healthcare Network. There's also a very good chance that Triad Healthcare Network will change the way you receive healthcare in the future. Triad Healthcare Network is made up of more than 700 physicians that includes 170 primary care physicians at 56 locations. It is the name of Cone Health's accountable care organization.
It's really a group of physicians and hospitals that come together and agree to try to better manage the health of a population. And that can be managed in terms of cost and also can be managed in terms of measurement of quality metrics as well.
While getting area practices to coordinate care in the interest of reducing healthcare costs may bring back memories of HMOs from 20 years ago, Triad Healthcare Network isn't focused on reducing care, but providing the right care at the right time.
And really be more proactive in care. Right now we're very reactive in healthcare, and I think ACO is really trying to start identifying patients that really need to be coming in, that need to have their disease states managed, and using technology to help do that better.
Triad Healthcare Network is working with thousands of Medicare recipients in a multi-county region, making it one of the largest ACOs in the nation. Triad Healthcare Network isn't the only collection of physician practices in this month's Code View. The Cone Health owned and affiliated practices have a new name. They are now called Cone Health Medical Group.
If you think about the triple aim performance strategic target that we've been emphasizing in our strategic plan the last 2 to 3 years, one of those 8 or 9 components is physician partnership, and Cone Health Medical Group really is the embodiment of achieving that component of our overall strategic plan.
Cone Health Medical Group is made up of LeBauer Healthcare, Cone Health Regional Cancer Center doctors, Cone Health employed hospitalists, and numerous other affiliated practices under the Cone Health umbrella. Cone Health employees will soon have a new employee attendance policy. A team has been reviewing existing policy to fix areas where employees feel they are unfairly punished when they can't show up for work, such as calling in on a weekend or on back-to-back days. The new policy is half as long as the existing one and much simpler.
Before, we had a very difficult system to follow where it was a rolling 3-month period for employees to have to and leaders to have to track attendance for every 90 days, and it reset in some regards every 90 days. We've gone back and just said that it would be a rolling 12-month period, which will be much easier for the employees to follow and much easier for leadership to follow.
The new policy takes effect October 1st. You'll learn more about it in the weeks ahead. Don't forget to ask your supervisor to reserve your seat at a People Excellence Celebration session on August 28th, 29th, or 30th. A similar event was held for leadership in December, and it wasn't long before many were talking about doing the same for all employees, physicians, and volunteers.
I hope we're able to share a sense of our excitement, some of the accomplishments, and also excitement about our future. My hope is that we'll all come out of there as inspired as I was back in December when we did our first event.
Don't wait, the registration deadline is August 13th. You want to eat at one of the Cone Health cafeterias, but if you choose the meatloaf and collard greens, will that leave you enough unused calories for dessert? Now you can figure all of that out from your computer. Log onto the internet, pull up the menu, and there is everything you need to make healthy choices for the day or even the entire week.
The customers like to be able to preview what the nutritional information is before coming down and actually purchasing those items. It gives them a chance to shop online.
Nutritional information is still available on items in the cafeterias. This is just an added convenience. Check out the awards for the 20th Women's Only 5K Walk and Run. Mark Holler Jeweler has created a special piece for the winners in 13 categories. They were excited creating this pink quartz sterling silver necklace.
We'll sit around and talk about, well, what's going to be cool that gets the point across. Of course, it needs to be pink, or it needs to have a ribbon or something, and what can be kind of customized as opposed to something that you'll see in any store you go into. So we kind of brainstormed this one and actually did it early.
Holder says the creations are a great way to support the health of women in our community. Don't forget, you can sign up to take part in the Women's Only online. That's it for this edition of Code View. I'm Doug Allred, and we will see you next time.